Jessica Trowbridge's curiosity about the impact of exposure to environmental chemicals on health came out of her experience living binationally and experiencing the environmental burdens of pollution in her communities in central Mexico and Richmond, California. In her current position with the Program on Reproductive Health and the Environment, Dr. Trowbridge studied prenatal exposure to toxic environmental chemicals and infant neurodevelopment. Dr. Trowbridge's research fills a critical evidence gap needed to improve policies and education aimed at reducing toxic exposures to vulnerable populations. And of course, Dr. Trowbridge completed her MPH and PhD in my home department, the Environmental Health Sciences Department at UC Berkeley. And she's, of course, currently a postdoc with PRHE. So I'm going to turn over the screen share so that you can see her slides. And if you have any questions for Jessica, please drop them in the chat. I'll be keeping an eye on them. So yeah, I really appreciate you. And go ahead, Jess.
Great. I hope everybody can see that now. Thank you so much, Swati, for that lovely introduction. I am really excited to be here today and to share a project that I've been working on for over 7 years, pre-PhD. It's a program, I did my doctoral work with Dr. Morello-Frosch at UC Berkeley and the Women Workers Biomonitoring Collaborative. And I actually started this project as a study coordinator working full-time. I loved the project and the people I was working with so much that I decided to stay on for my PhD well beyond the grant cycle. And here I am today, still collaborating with the Women Workers Biomonitoring Collaborative. So in my talk today, I'm going to talk about my doctoral work, which was on characterizing occupational exposures and their association with biomarkers of effect in women firefighters. I'm first going to talk about exposure assessment of PFAS chemicals in the women firefighters compared to office workers in the city and county of San Francisco, where I looked also at occupational predictors of exposure. Next, I'll describe the exposure to flame retardant chemicals and women firefighters and their relationship with thyroid hormone levels as a biomarker of early effect. And then I'm going to talk about some of the research, translation, and policy work that has really come out of our work with the Women Workers Biomonitoring Collaborative. This study was a community-based participatory research study, which was actually started by firefighters who were raising concerns about increased rates of breast cancer among their cohorts and among their colleagues. The San Francisco Firefighters Cancer Prevention Foundation reached out to another firefighter organization, the United Fire Service Women, who really wanted to do something about this problem. They reached out to community advocates, which included breast cancer prevention partners and Commonweal, and to scientists at Silent Spring Institute, UC Berkeley, and UCSF. And together we formed the Women Workers Biomonitoring Collaborative and created a study to look at exposure to toxic chemicals among women firefighters. Now, firefighters are a uniquely vulnerable population. We know that firefighters are exposed to multiple different toxic chemicals through their work. We know that firefighters have higher rates of cancer than the general US population. There was a meta-analysis in 2006, an international one, that 32 studies that found firefighters had elevated rates of lymphoma, testicular cancer, and prostate cancer. This meta-analysis was later updated in 2019. They confirmed the findings of the previous one, added 17 studies, and also found increased rates of brain, bladder, and colorectal cancers. But all the studies in both of these meta-analyses were among men, and they did not include breast cancer or women-specific cancers, specifically because of the lack of women firefighters or the low numbers of women firefighters in most fire departments. So indeed, very few studies have assessed breast cancer or chemical exposures of women firefighters because most fire departments have too few women to conduct any studies. IARC has assigned the occupation of firefighting as IARC has evaluated the occupational firefighting. In 2010, they assigned it as class 2B as possibly carcinogenic, and they did not go higher because they lacked human evidence for cancer. And in July of this year, in 2022, IARC announced that it has updated their assessment where they established firefighting as a class 1 carcinogen, and it's carcinogenic to humans, specifically for mesothelioma and bladder cancer. And as far as I know, it is the only occupation specifically that has been evaluated for breast cancer. There are other general occupations, but this is the first one that's of occupation. So women are chronically understudied in occupational settings. This is relevant to things like the design of protective gear, which is often designed to fit men's bodies, and to workers' compensation benefits. And so in firefighting and in first responders, there's a presumption clause, which is workers' compensation benefits that are established by the state. And the presumption clause provides compensation benefits for firefighters and first responders who get cancer that are deemed to be work related. So breast cancer has historically been excluded from these laws. States decide individually on what cancers they want to cover under their presumption clauses and whether or not they'll cover breast cancer. California does. The number of states that are covering breast cancer in their presumption clauses continues to grow, but many states still do not, and still often lack the number of studies in women firefighters as to why they don't. So women firefighters in San Francisco had been raising concerns about elevated rates of breast cancer among their colleagues for several years. And these are some images of news articles that came out around 2013, 2014, right as our study was getting started. Now, San Francisco has a really unique history of women in the fire service. 1987 was the first year that women were hired by San Francisco Fire Department. This was the result of a lawsuit and a following consent decree or mandate from the courts that San Francisco Fire Department had to end any discriminatory hiring practices and integrate women into the San Francisco Fire. So since 1987, which isn't that long ago, huge steps have been made in this regard. San Francisco has now one of the most racially diverse and largest forces of women firefighters in any large urban fire department in the country. There's over 300 women firefighters in the fire department. That's over 25%. And San Francisco Fire Department is led by the second woman ever to be a fire chief of a large urban fire department, the first woman being her predecessor fire chief in San Francisco. So now we have a cohort of women, many women in San Francisco Fire Department who have spent 30 plus years, their entire working careers as firefighters. And women are concerned about their exposures and their risks for cancers as in par with the men. So in this study, firefighters really were interested in understanding, does my job cause cancer? A very simple question, but there's a lot of challenges studying breast cancer as an outcome. So for example, the long latency period, that it takes a long time between exposure and the occurrence of cancer, that could really limit opportunities for prevention. Even though San Francisco has a large firefighter population, we're still relatively underpowered to assess breast cancer as outcome. You need very large populations, very large cohorts. And so these types of studies, following people for large cohorts for a long period of time, cost a lot of money. So because we're a CBPR study, a community-based participatory research study, we agreed through a lot of conversation and through consensus that this study would be an exposure study focusing on chemicals that are suspected or known breast carcinogens based on animal or human studies. And we focused on two classes of chemicals that we expected to find in firefighting. One was PFAS chemicals, and the other is flame retardants. Exposures to both of these classes of compounds are very common. They're widely used in consumer products. PFASs are commonly found in food packaging like pizza boxes, frozen food, and paper takeout food containers. They're also added to fabrics, furniture, and carpets for their stain and water resistance. And so they're in waterproof jackets and in turnout gear. They're also an ingredient in firefighting foams. Flame retardants are found in furniture, car interiors, and electronics. And for a while, they were even added to children's pajamas until they were banned in the 1970s. California has a long and complicated history with flame retardants in furniture. We had a law that required furniture sold in the state had to withstand an open flame. This led to the use of hundreds of thousands of pounds per year in furniture and really led to elevated exposures nationwide, since furniture manufacturers made all of their furniture to the California standards. This law changed because of concern for exposure and the bioaccumulative properties of flame retardants. Some flame retardants were phased out, others came in. And so since this law was changed in 2013, right as our study was getting started, there has been a shift in the types of flame retardants that we are seeing. However, we don't change our furniture very often, and they remain to this day a reservoir of flame retardants in our home, furniture, and offices that really make fighting fires more toxic when they do occur. Some of the health effects associated with PFAS chemicals include mammary tumor development, thyroid hormone disruption, immune suppression, and metabolic effects. Flame retardants have also been associated with mammary tumor development, thyroid hormone disruption, as well as neurodevelopmental effects in prenatally exposed infants. So first, I'm going to talk about PFAS levels in firefighters and office workers. We found that firefighters have elevated levels of multiple PFAS chemicals, but first a bit of a roadmap to orient you on my graph. On the bottom are the different abbreviations for the PFAS chemicals we measured. The red dots are firefighters, the blue dots are office workers. The solid dot in the middle is the median or the 50th percentile, and the star is the 95th percentile, or that is the level below which 95% of the population has their chemical levels. So firefighters and office workers had similar median levels to each other, except for PFHXS, PFUNDA, and PFNA. PFHXS, PFNA, and PFUNDA. Firefighters had higher median average levels than office workers. And this relationship was further maintained in adjusted linear regression models where we controlled for things like, we controlled for age, race, ethnicity, and educational attainment. So the dot is an exponential beta coefficient, a measure of effect, and the line is the confidence interval, the 95% confidence interval. The chemicals are on the vertical axis, and the null is 1. So the largest differences between firefighters and office workers were for PFBS, PFBUS, and PFHXS. And the average levels of PFHXS in firefighters was almost 2 times higher than the average levels in office workers. We conducted a very long exposure assessment interview where we asked firefighters about occupational activities and that they participated in. We also conducted exposure assessment in the office workers as well. I'm going to focus though on the firefighters. And in linear regression analyses, we found that firefighters who had used firefighting foams in the past year had higher levels of PFOA and PFOS compared to those who hadn't used it in the previous year. And this picture I like for several reasons, because it highlights several occupational exposures and exposure reduction efforts in the firefighters. So first is the personal protective equipment, which is both prevention from water and fire and heat, but is also a potential source of exposure to PFAS chemicals. The yellow bucket here is for gross decontamination in the field. And so this is meant to reduce exposures after fighting a fire, which has soap and water and a brush, and it's filled with water. And so the firefighters can then brush off their gear before putting it in a bag before they get in the truck, which would reduce transporting exposure from one place, from the fire field to their fire stations or their trucks or vehicles. And that decontamination bucket is sitting on top of a big bucket of AFFF firefighting foam. We found also that position in the fire department also matters. In the exposure assessment interview, we asked firefighter positions about their assigned role in the fire department. And so fire departments rely on ranks to determine roles in the chain of command at incidents and emergencies. And so while firefighter is a profession, it is also a rank. Firefighters are responsible for the hands-on actions of fire suppression and rescue. Officers, who include lieutenants and captains, in addition to fighting fires, also coordinate teams, schedules, and trainings with their fire station or unit. And a driver is responsible for driving the apparatus or engine. They maintain the pump and aerial ladder operations, and they provide critical support to those fighting the fire. So I use linear regression to evaluate the relationship of assigned position in the fire department, that is drivers versus officers or firefighters. And I controlled for race, ethnicity, age, and years of service in the fire department. And so I found that firefighters and officers had higher average levels of 5 PFAS chemicals at the top, 5 PFAS chemicals compared to the drivers. This was published in ES&T in early 2020. So, and I think Swati sent the paper around if you're interested in learning more about what we found in our women firefighters. So next in the women firefighters, we assessed the difference in flame retardant chemicals between firefighters and office workers and their relationship with thyroid hormone disruption. We quantified 8 flame retardant chemicals. Their abbreviation is along the bottom. There were several organophosphate and organochlorine flame retardants and 2 brominated flame retardants. So the image is the concentration by occupational group. The red is still the firefighters, the blue is the office workers, the solid dot is the median, and the star is the 95th percentile. If you follow the solid dot representing the median levels, we found that firefighters had higher median levels than office workers for 3 of the chemicals. For 5 of the flame retardants, the median level was below the limit of detection. But if you look at the 95th percentile, we'll still see that firefighters have higher 95th percentiles than the office workers. And for BDCPP specifically, median levels of the firefighters were 5 times higher than the median levels in the office workers. BDCPP is a metabolite of tris-1,3-dichloroisopropyl phosphate, also known as chlorinated tris, and this was the chemical that was banned from children's pajamas in the 70s. We also compared the chemicals that we measured in our study with a nationally representative sample of the US population, that is the National Health and Nutrition Examination Survey, or NHANES. We focused on the 3 compounds that had the highest detection frequency in the firefighters, so above 70% detection frequency. And so in this image, the red is the firefighters, the green is the office workers, and this gray dot is NHANES women. And compared to the general US population, women firefighters still had higher levels than NHANES, and our office workers had either similar levels or lower levels than the National Health and Nutrition Examination Survey women. We also looked at associations with firefighting activities, use of firefighting foams, et cetera, but we did not find any association between OPFR levels and our firefighting activities. So I mentioned earlier that we did an exposure study focusing on chemicals that are associated with breast cancer in either animal or human studies, yet we still wanted to know if there was any evidence of biological changes in the body that are associated with chemical exposure. So to do that, in the study, we measured total thyroxine, or T4. This image here is an image of thyroxine, or T4. And we also measured thyroid stimulating hormone. Thyroid hormone is associated with multiple downstream health effects, even at subclinical levels, and has been associated with cardiovascular disease, breast cancer, and neurodevelopmental effects for offspring exposed in utero. And so thyroid hormone can be a biomarker of biological effect that is associated with multiple downstream health effects, and that is potentially associated with exposure to toxic chemicals. I assessed the relationship for flame retardant exposure with this total T4 and TSH, and because of the very different detection frequencies and levels that we saw between the firefighters and the office workers, we actually stratified this analysis by occupation. I also limited the analysis to those chemicals that were detected at least 70% of our firefighter participants. So in this image, the dot is the beta coefficient and the 95% confidence interval, looking at the association, the percent change, actually it's the percent change, not the beta coefficient, my apologies. The percent change in the 95% confidence interval for exposure to each of these chemicals with thyroid, with total T4 or thyroid hormone. The no change is seen by this dotted line at 0. And so what we found was that a doubling in BDCPP, this first top line, was associated with 3% decrease in thyroxine among the firefighters. And DBUP was associated with a 2% decrease in thyroxine. We did not see an association among the office workers. They also had a lower detection frequency and lower levels of chemicals. And we did not see any association with OPFRs or TSH in either of the 2 groups, firefighters or office workers. This was published in ESNT in November of 2021, in case you would like to read more. So firefighters have higher levels of exposure and evidence for thyroid hormone disruption in relation to flame retardant. So now what? Glad you asked. So as a CVPR study, the policy change and education efforts were at the forefront of what we did as a study team. Firefighters in our group wanted to make sure that the research that they were collaborating with and participating in really included actionable results. And so this included individual report back using Derby or digital report back interface. And what this does is we provided individual level results to participants who requested them. And this is a picture of our landing page where individuals would see an overview of what they might find in their results, and then could click into seeing their individual level results, which looked like this. We showed how their levels compared to other firefighters in the study. So in this case, the red dot is the individual for whose report this is, and all the other dots are all the other participants in the study. We also showed how their levels compared to the NHANES or the national, I just blanked on the name, NHANES from the CDC. And it also shows the median level in the group. And we did this for each of the chemicals that we measured, that we quantified in our study, both PFASs and the OPFRs. And then we also gave tips on preventing individual level exposures and the importance of political action, because we know that many exposures cannot really be prevented at the individual level. Firefighters took the findings from the study and developed a training on reducing toxic exposures on the job. A group of firefighters developed this training called Extinguishing Breast Cancer from the Fire Service. And they presented this training to fire departments across the country and in San Francisco. And this is a handout from that training, which provides some of the 5 tips to reduce exposure after a fire event and to prevent tracking toxic exposures back to the engine or station. And you can see here's the gross decontamination where they're possibly using that bucket in the picture. Our research and our papers have actually helped inform new California legislation. In 2020, Governor Newsom signed the California legislation that would phase out toxic forever chemicals, also known as PFASs, for firefighting foams. And PFASs can contribute to are a major source of drinking water contamination in the state. So that was really a really important win for us as a state. I also had the opportunity to give expert testimony to the Alaska State Legislature, where I talked about the evidence for exposures in women firefighting. And this was as they were considering including breast cancer in their cancer presumption laws. And I recently just saw that the governor signed into law that breast cancer is to be included in Alaska's cancer presumption clause starting next year on January 1st, 2023. So in my talk today, I have presented evidence from the Women Workers Biomonitoring Collaborative that women firefighters have higher occupational exposures to toxic environmental chemicals that are linked to breast cancer than the general public. I've also demonstrated that OPFR chemicals are associated with thyroid hormone disruption. And I've highlighted some of the translation and policies that have been leveraged from our work. And I really appreciate everybody taking the time to listen to my talk today. I consider the WWBC, the Women Workers Biomonitoring Collaborators, my friends, and I would like to thank everyone on the WWBC team, my advisor, Rachel Morello-Frosch, the participants of our study, and all of my mentors for really allowing me to be a part of this work and this WWBC family. And I share this picture, which is at the San Francisco Firefighter Union Hall, posing on a old vintage fire truck, which is probably one of my favorite pictures from the study. And thank you to Tracy Woodruff, also my mentor here at my postdoc, who has given me the chance to continue doing this work and to explore other avenues of research. So thank you.
Amazing. Thank you so much, Jessica. That was a great talk. We have like probably about 10-ish minutes for folks. If anybody has questions, you can either raise your hand in the chat, raise your hand on Zoom or type it in the chat. But I guess I'll kick us off. I have like a first question. I really love that your participants got a chance to, kind of have access to their data and like log in and really try to understand it. I think a lot of times when I think about communicating scientific information to study participants, especially, I really grapple with like how to communicate it to them in a way that doesn't feel like there's no hope or no help, or, just that is totally not apocalyptic sounding. So how did your team kind of navigate that relationship and, kind of general bad news, right, for your participants?
Yeah, it's a challenge for sure. And others, some of my colleagues from our team are on here, and if they have anything to add, please jump in. One of the things that we did was we developed some mock-ups of results that we presented to the firefighters and to office workers, and developed a material based on what it was helpful for them to see. And really, one of the things that came out from those was, what can we do? What can we do? And so we tried to add as much information. We also highlighted what we don't know, and that I think it's important to know when you can do individual action and when you can't, and like how you can be involved. So I think we tried to keep it as actionable as possible. Heather, I see your image. Do you have anything to say?
Hey, y'all. Hi, Jess. I'm Heather Buren. I'm a firefighter and worked with Jess on this study, and also feel like we became friends during that. And what I wanted to just say, and this is not to add to what you were saying, Jess, but really to just reiterate how well this team responded to our community, our women firefighters, and how Derby actually was something that the layperson could understand. Like, it was broken down in this way where you could look at the chemical, it would talk to you about where you find the chemical, and really it was like layers. So the more information you wanted, if you did, you were able to do that. And I have been a part of other studies where I didn't understand the results at all. So because of the community-based aspect of this research, but also I feel like the scientists and the advocates we worked with, that seemed to be a priority. And I just want to thank Jess and the rest of the scientists for that, and let any of you scientists out there, especially with obviously community-based science, that's the end goal, that we can understand, the layperson can understand the work that's being done, and hopefully react in a way where we can educate and learn, or however that goes. But I just wanted to say that, and thank you so much, Jess, for all the amazing work that you've done through the years for my community.
Thank you.
Absolutely iconic, Heather, from the beach. With, I think, your government.
Sorry. Yeah, I am. Just got off shift, and so he had to get out, so I had to join. We make it work.
I love it.
Thank you.
Jessica Rainier asks, do you have any insights into why PFUNDA is higher in firefighters and presumes not part of AFFF?
That's right. Well, it's interesting. When I was looking up, trying to find what was in different ingredients, AFFF, what's being used for water resistance in turnout gear, it's pretty impossible to find what's in there. Some studies have done some chemical analyses of AFFF, and I think they find more potentially PFHXS, PFAS, and PFOA. I did not see anything about PFUNDA, so I can't really add much more to what are some potential sources for PFUNDA at the moment. And I didn't see anything in my lit review when I was searching for that, because I was trying to figure out what might be leading to that, but I don't know.
Any
I had more.
So I was just wondering, I mean, it's almost more, I would think of it as a tracer for fish consumption, but I assume there's no obvious reason why they would eat more fish.
We did ask about fish consumption. I don't remember off the top of my head. It didn't stand out as being higher. For example, firefighters ate a lot more barbecue, than non-firefighters, and this makes sense because they cook together in their firehouse. But I didn't see anything on fish.
Okay, thanks.
Interesting. Maureen Swanson wants to know if you've started looking at women firefighters exposed to wildfire smoke. And says there's emerging evidence that the smoke from climate-driven wildfires is much more toxic than in past years, and cites that Dr. Coleman at NAHS gave a presentation mentioning a study finding 2,000 more toxic chemicals in soil from urban wildfire sites compared to sites where only trees burn. So WUIs versus wildfires.
Yeah. One challenge, I think, with these studies of women firefighters is, where do you find enough women firefighters to be able to conduct a study? We were lucky in that San Francisco has a really large force of women firefighters. I compare the number of women firefighters to the numbers in New York. San Francisco, New York City Fire Department has over 10,000 firefighters, and I believe it's about 1% to 2% are women. That's less than 100 firefighters in their entire fire service. San Francisco has 25%. So that makes it much easier to conduct a study in San Francisco. We have done a few exploratory studies. Well, one, we did some sampling of urban firefighters who get sent to do mutual aid or support to wildland fires and the WUI fires, the wild urban interface fires that have happened in the past couple of years. We were looking for funding and to try to do more of those. And so it's something that we're considering as a group, but hasn't panned out yet. Also, getting access to wildland firefighters can be very complicated. And I see Maria asked about California prison firefighters, and I've been asked that question a lot. It's really, really hard to do studies on prison populations. There's a lot of IRB, rightly so, hurdles that would really make it kind of impossible to follow prison firefighters.
Yeah, I will also make a note that like positive programming at women's prisons occurs at a much lower rate. And technically the firefighting program at California prisons is a positive programming for expedited release, right? Work for expedited release. And so I think proportionally, one, inherent sexism within the prison system determines who gets assigned what kind of occupational tasks. And then also, again, proportionally, how many services are available to the actually insanely increasing population of women prisoners we have in this state. Any other questions?
This is Maureen.
Go ahead.
Thank you, Jessica. Sorry, I'm staying off video because my internet's not great, but thank you, Jessica. And that's, I'm sure an area for future research as more and more firefighters, men and women, are exposed to this new type of wildfire smoke that's more toxic, and wildfire burning, just burning more businesses and residences than in the past. I hadn't realized that there was a difference between urban and wildfire fighting firefighters. So thank you.
That's right. Yes. And I do know that NIOSH has, they have a few people working on wildland fire and different health effects as well. So there is some work that's being done.
Nice. We have a couple of more minutes if anybody wants to unmute or drop a question into the chat. Going once. Okay.
Great. Thanks so much.
Ooh, what's this? Oh, Maureen says, I worked with Pittsburgh firefighters 5-6 years ago as a part of the effort to get FRs out of furniture. Pennsylvania has a cancer presumption law for firefighters. Oh, that's great.
Well, it'd be interesting to know. Yeah.
Yeah, definitely.